So thank you for joining us today. My name is Emily Davis. This workshop is searching for health statistics or health data. We are going to look at a couple of websites and also some of the databases and library resources that are available here at Waters Library. I am a research and instruction librarian. My focus is the health science and social sciences. My contact information, you can either contact me directly via my email address, which is emily.davis@etamu.edu, or you can contact all the librarians at etamu.edu/AskWaters. Today I'm going to look at some different types of health information, and how those statistics and data are created and the use for them. And then, of course, we're going to navigate some of the resources to find reliable health information or health statistics. First thing is health statistics. What are they? Health statistics, they're going to be the numbers and data that summarize health-based information, such as prevalence of a particular disease in a certain population or globally, mortality rates for drug overdose, or maybe the mortality rates of a particular type of cancer, even down to the cost of healthcare, both on uh, the populace, the patients who are using the healthcare, or even the cost of it towards for the hospitals and like the resources that use and the overall cost to give the healthcare. So these are all health-based information, so they all create health statistics. Health statistics are used to understand different risk factors and not just for the community, your local community, but globally. So understanding the risk factors for communities, being able to monitor different health events, so such being able to prep for example, when COVID hit, uh, having the scientists and the medical personnel trying to be prepared for a global event like that to happen. So we do have people who are their entire job is to be studying what different possible health events could be happening and hopefully get ahead of those. And they use health statistics, health data to do that. There's also to impact different policy changes. So, instance, the policy of everyone wearing a mask, that was a policy change due to health statistics that were being used at that time. And then, of course, to assess the overall quality of healthcare, to make changes in the healthcare environment, um, they all use health statistics to back up their statements and to make these decisions. Health statistics are very important for two main reasons. They provide evidence-informed policymaking and also evidence-based medicine. So both of these evidence-based medicine and evidence-informed policymaking, these are both essential for knowing how to best provide healthcare and promoting a healthy community. Now, there is a note that not all health data is equal. It is highly important that you, as the researcher, and that you are accessing transparent, high quality statistics and information. So, with all types of research, there is the possibility of biases coming into it, especially in certain types of health statistics that are either self reported. Certain survey questions can be leaning towards one direction or the other. Also, health statistics can be taken out of context. So, that's something you're going to have to look into, being aware of when you're looking at that information. Where are they getting their information? Are they providing all of it there? Or are they leaving out different factors that could be changing the overall conclusion that you would have drawn from those statistics? Some different ways that health statistics are collected. Surveys, which are often self-reported information. This is really good for getting like quality of life type information, also getting a second view of why an individual may not choose to go to a particular hospital. A survey would be a great way to get that information. Administrative and medical records, healthcare claims, for your insurances, vital records, census data, disease registry and surveillance trends. And then, of course, a lot of literature will also have health data and statistics in it, in particularly anything that is a random controls trials, case studies. These will all have research in them that they should tell you how they got those statistics, how they got that data, and you'd be able to analyze it from there and draw your own conclusion, as well as seeing what conclusion they drew from it. You also have that with certain reviews, although reviews are going to be mostly reviewing the literature overall, not necessarily the research data that's in it. So if you are looking at a review and it's showing does have statistics, you're going to want to track down the original document that it is reviewing so that you can hopefully see the overall information of that and how it all connects. Okay, now going into the fun thing, talking about different types of statistics. Typically 4 different types that are measured, commonly referred to as the 4 Cs. These are data that correlates, conditions, care, and cost. So for correlates, these always refer to the determinants of the health. So things that are risk, protective factors. So anything that kind of links to them each other. Such as income, the education factors, air pollution, personal habits, such as if they exercise, don't exercise, alcohol, smoking, things like that. Those are all can correlate to health conditions. There is a note, correlation does not equal causation. My favorite example of this is that along the coastline, when sales of ice cream go up, hospitals start seeing a lot more shark related injuries. Now, I'm not sure about y'all, but I'm pretty certain that sharks don't care whether or not you eat ice cream or whether or not you have ice cream on you. You'll note that ice cream sales go up, so do shark injuries go up. This is mostly due to other factors, not necessarily the ice cream. So that's another thing you have to look at when you're looking at data and in particular correlates. You have to look at why they're correlating. Is it just because they're happening at the same time, or is there actually a relationship between these 2 or more factors? Now, conditions are a little bit different. So these are most common. They are the incidences or the number of increased cases of a particular condition. Prevalence is a particular portion of the population that has this condition. I'm going to throw something out there because I don't have an actual number, but like 30% of all high school students eat chocolate. No, that's not a health statistics, but it's a portion of the population that eats chocolate. Morbidity is the state illness of the population. So is it a healthy population? Is it not? Is it poor? Things of that nature. And then mortality, of course, is the number of deaths. These can be interrelated with each other, and sometimes you may have just one for what you're studying. Sometimes you may have all 4. Maybe you'll have a variety of them. It's very important that what you're looking at and the numbers you're doing report the measure that best answers whatever your research question is. So while prevalence may answer your question, the number of cases might give you a more precise and more exact view of what you're looking for. And then the care. So this is going to focus on the overall state of the healthcare system and the services. A lot of this could be answered via surveys because you're wanting to get whether or not certain hospitals have a success rate and how satisfied are patients with using particular hospitals or using particular doctors. So there's a lot of places where you'll get the reviews. There are some concerns when it comes to looking at the care topic. You have a lot of health disparities. So these are differences in health outcomes and care that are based to either social, economic, or environmental disadvantages here. So if a certain population isn't being treated the same as another population, that can affect the overall state of the healthcare system and services. So when you're doing that research care, you have to make note of any health disparities that might be affecting the results and the numbers and information that you're getting. It also, due to health disparities, may be that you cannot find information or a lot of information about a particular population in their care. So for instance, if you're wanting to look in particularly a Hispanic rural environment and you're looking at the healthcare system in that area, you may not find as much information, whereas if you were in more of an urban area and you're looking at the healthcare system there. Another concern is data disaggregation. I'm basically separating the data into variable interests or the individual units. Oftentimes when we are searching for data and we're not doing the boots on the ground research ourselves, then the information that you're going to get is more into grouping. So you'll have an overall population of 30% of country residents have this condition, or rural residents have this condition. Maybe you want to look at rural patients over the age of 80. Maybe you're wanting to go down even that further, and you can't necessarily get that information because either A, you're not doing the research, so the only data you're getting is just overall rural information rather than the specific. In some cases, you may only get an overall county information rather than a certain district within that county or even on a country level. Now, there are a couple of ways to work with this and to make the data usable, even if it's not as detailed as you would like. It all depends on your research question and being able to work around the data that you do have. For example, if you're analyzing the relationship between the percentage of people with asthma in a county and the air quality, you can look at county health departments, education and awareness programs to get the air quality alert days. You may not have the individual information. You can look at an entire different department and look at the programs and that information to get an average alert quality or alert days rather than just looking at the overall county data. So it really depends on your question and how you're phrasing things. But speaking of the research questions, when you're looking for care and you're making a statement, you got to be careful with your own research question that you're not building in possible health disparities, that you're not ignoring these other factors. Even if these factors are not necessarily a big component, it's always good to be aware of them because down the line they could be affecting the factors that you are trying to research. So it's always good to make sure to look at the different sides of your own research question, try to see what factors may be related to it, and then what factors could be affecting it. And then cost. So this is one that you can hear a lot about. It measures two particular costs for healthcare versus poor health. The first cost, the one that's usually the most easiest to see, because generally speaking, it's almost always a hard fact. So this is the economic cost of healthcare. So this is like the price of health insurance, and other factors that drive the growth of healthcare spending. So these could be things of you have the price of equipment, the availability of certain things, such as the availability of the mask during COVID. So these are all economic costs that could happen. And even if you think about it in the long run, the ability of hospitals to get the correct gear that they needed in order to treat patients is also an economic cost that you can see in that could be related to healthcare. The other one is social costs for healthcare. Now, this one is a little bit harder to get a definitive answer on because oftentimes it is a self-reported. The most common one is a measure of quality of life, and particularly the reduced quality of life. There are two different organizations that have a really good survey that they do. So the Center of Disease Control and Prevention uses a measurement called health-related quality of life. They do abbreviate it. This looks at different things such as number of days that you felt healthy, number of times that you exercised, and the number of times that you went to the hospital for a particular condition. They look at all of these, and again, it's mostly self-reported in order to get a average quality of life. Now, the World Health Organization also has an example of this. They use something called disability adjusted life years. as an indicator of an overall burden of a particular condition. So this measures combines the years of life due to either an early death, due to your particular condition happening a lot sooner, so the years that you lost on average, and the years of life lost due to a particular disability to provide an estimated condition burden that includes both the mortality rate and the quality of life. So it tries to mix those two and get a more rounded answer. But in both cases, well, at least particularly for the CDC case, that is mostly self-reported, whereas the World Health Organization looks at and tries to find more of a concrete data while also having that self-reported in it. Societal costs are useful, especially when you are trying to look at satisfaction. I would say it's more used on more the administrative level and the policymaking level and more on the business side of healthcare rather than just your preventive and physical care of the medical world. Okay, now searching for health statistics or health data, there's a couple of different steps, and along these steps that I'm going to show you, there's going to be questions that you want to kind of ask just to kind of figure out where you're going to find this information and how you're going to access it. So 4 things you need to know: the type of information you need. So for instance, do you need care? Do you need cost, condition? So which one of those health information types are you needing? You'll need to know the scope of your data. You'll need to know who collects that data. Are you going to use like a federal or an international agency who's already has that data collected? Or are you personally going to take surveys and hunt down that information and do a study? And then you can also look at who's sharing the data, how it's being shared, and who has access to it. And then you're going to have to look at how are you going to access that data. Is it something that's freely accessible, so you can just go to an agency's website or a hospital's website, it's right there, easily available? Or do you need to go through a paywall situation? Are you part of a library? Are you part of a hospital that has access to particular databases? Is it something that you're going to have to purchase? All of these things are things that you need to know. And then I'm going to go in a little bit further in this. So like I said, identifying the different data types, this is what you want to think about. It's not only the type, but how you need to present that data and how it is presented. So are you looking for a complete data set? Is it something that you need like the individual information of, or is it something that you can just take the summary of or another analysis, like a meta-analysis of it or a systemic review? Are you needing that information to be in charts, or is numbers fine? How are you needing that information, and how specific are you needing that information? And next, you want to think about your scope. So you want to think about where and who of your data. So this is the population. Are you wanting country? Do you want state, nationwide, possibly global data? Are you looking at, like I said, the individual level, or are you wanting more of like a country level, county level, or do you need to look at specific population? Maybe you're looking at the rural versus the urban. Maybe you're looking at a particular condition. If you're looking at a specific system, like maybe you're looking at Hunt regional care, or maybe you're looking at a particular type of care, such as physical therapy. So these are all questions that you need to have answered before you even start trying to figure out where you're going to get this information. Once you have an idea of the type of information you need, you want to figure out who has that information. I would suggest identifying one or more organizations or agencies that are likely to either collect and or share that information. So for instance, the National Center for Health Statistics measures and monitors the health of people across the United States. So it's often a good place to start if you're wanting to look at the overall United States health. Other things are the CDC has a database that goes in on the United States as well. And then if you're wanting something more global, you can do the World Health Organization. They also have a database, which I will go into further as an example and let y'all see how you can find data on that. And then you're going to look into accessing the data. So you want to identify the specific sources that you just identified that they had it. Now you want to look at the resources that answer your needs to begin your search. So, for instance, if you're looking at the organization or agency's website, you look for a tab that says data, statistics, research. These are all standard really for it. Now, there are a couple of agencies that like to hide things. Um, Oftentimes, if there's a search box, this is a good place to type in either data, statistics, research, type this in and be able to pull it up. The CDC is one of those that likes to hide it. It's not just like go to their main website and then you'll easily find it. I happen to know what their database is called, so I'm going to share that with you. Oftentimes, I just have to Google the database's name to be able to pull it up. I will share the link with y'all, and I will, of course, give you the name of that particular database when I'm showing it to y'all. Another one is if you're using a particular database that you have access through either the library, or maybe you work for a hospital and you have access through databases through the hospital or medical facility, and you're looking at a particular article, such as case studies, random control trials, or even clinical reviews, you're going to look for sections that say results. And you're also wanting to look at sections that say method. So the method, of course, is going to tell you how that information was gathered. This is where you're going to start looking for those different biases and maybe conflicts that could have happened. And then, of course, the results is going to be the results from the study that they did. In this case, you're going to have to look like how are they compiling those results. When they're giving those numbers, you want to look to make sure that they're not trying to lean one direction or the other. So you want to check for those biases that are there. Okay, so these are a list of online resources. Some of those I have mentioned. A couple of those we'll actually look at today. So the National Center for Health Statistics, that's the United States information. World Health Organization, that will be global, but you can actually find individual country information as well. So if you're wanting to look at the overall health of, let's say, France and compare it to the United States, World Health Organization would be a good tool to be able to do that. The Center for Disease Control and Prevention, the Centers for Medicare and Medicaid Services, the United States Census Bureau, you can get a lot of vital statistics from there. And then healthdata.gov is another really great source for finding a lot of general information specifically about United States health. Particular resources that you can find health data from that are provided by the library. PubMed, this is also an open access one, so you're able to access it even if you're not affiliated with the university. CINAHL, Science Direct, PsycInfo, Web of Science, and the one I will be showing you today is Sage Data. We also have research guides in the health section that will also have links to other resources, as well as tips and tricks for figuring out methods to use, such as for our nursing, we have the PICO method. It's really great to find various health data and information. All right, now for the fun part. Okay. So I'm actually not going to do the library's resources just yet. I'm going to jump into and show you the ones for the CDC. So this is the CDC's database called Wonder. There we go. They're going on an update to hopefully make everything a little bit more easier to navigate and simpler to understand, which will be awesome. But if you come down here to it, you can look at the different information. So what do you want? Do you want to look at multiple different causes of death based on all ages? We can look at cancer statistics. And you can request the data, find more information in between these years. It'll give you all kinds of different ways to access the different information. Also, where are they getting their information at? What program are they using? What questions are they asking? All of that data is here, which is a really great for when it comes to you evaluating it and getting as detailed information as you can. One more. You can also look at it not just at the different systems, you can actually look at it via the condition. So you can go all the way down there, go all the way down to that detailed of a level. And even with these, that you'll go into them. Again, with cancer, we'll have different links and information where you can find it, as well as the statistic reports, so you can look at those. It even has the actual profile website, so you can find all that information there. And if you have any questions with the CDC, you can contact them via an email. I don't know their response rate to answering those questions. So if you're doing a project or you're researching something that is on a very quick timeline, possibly look for other resources, not just the CDC. All right. And then, of course, the CDC also has the National Center for Health Statistics. I actually like fast stats. Um, I found it to be the most recent and easiest to kind of go through and be able to navigate. So you do have all these different filters here to be able to work with, and you can click on them. For instance, arthritis. It gives you the morbidity rate, tells you where they got it from, and give you a link access to that. And then more data, and of course, related links, surveys that they do. So you can research how they got that information, not just going, oh, yay, this is the number, off I go. Also, by looking at how they got the information, where they got that information, can also help you when you go and try to create your own studies. So if you're trying to do a deep dive research, or maybe you're working for, again, a hospital, maybe you want to look at just um, the rates and the prevalences around your hospital. This can give you an idea of what type of information to look for in your hospital, what type of questions to make if you're going to do a survey. It also gives you something to compare your hospital to, or your institution to. So looking at and having access to that information, even though it may not be necessarily the information that you need in your research, it does provide you with tools to support your research. Okay, and then of course I wanted to show y'all the World Health Organization. It's relatively easy to find it on this one. A few of the government agency websites, excluding the CDC, also make it really easy. So you see where we said data, you can click on it. And then data at the WHO, you have the dashboard, collection. You can look at particular data by the collection. You can go straight to the data hub, look at various indicators. Uh, they have a couple here that you can just look at through there, or if you have like a particular term you want to search for, you can also look at a particular country. So how I mentioned comparing France, you can look at the current health expenditure, you can look at life expectancy, leading causes of death, health statistics. Now, and sometimes the information is not available. This is the information that is reported to the WHO. It does give you the date of the year that it's from, and then it gives you the worsening sense. It kind of tells you that information. You can also look at progresses, other resources it can give you, and then of course you can go back to all countries and then look at whatever other country you want. So for instance, United States, you have the overall view, and again you have all the other data that goes with it, and you can download any of the information that you need. So you can compare different countries that way. And of course, more information. So the WHO does have a rather easy database to go through and be able to navigate and understand. And they do give you the information of when this is coming from, where it's coming from, all of that. So now that I've talked about those, I'm going to actually look into what information the library provides. So I'm going to show you SAGE data. So this one's not just health statistics. So from the Waters Library homepage, database tab, you can either type in SAGE data, or you can click on the letter S and then scroll down. SAGE data, there we go. So as I say, this covers a lot of different global statistics. You can come through here. I usually try to do it via browsing the data so I can look at all the different categories, but you can also look at different data sets if you need more assistance in going through. They do have the help buttons. So for just an example, I'm going to go to health and vital statistics. I now have the options of all these different data set collections here. And the particular one that I want to go with is I had it listed so that I would know which one I was going to click on. Ah, okay. So the one I'm going to look at is Alzheimer's disease and healthy aging data. I'm going to go ahead and look at the overall health, but you can narrow it down to mental health, maybe caregiving, the nutritional, physical health of it. But I'm going to look at overall. You now have this wonderful table here where you can select the different years. Either do by region or state specific. And if you click on that, it'll actually give you that new panel so you can look at the various states. I'm just going to go and keep on US. And then if I scroll over, I can choose the topic. So I can do physical unhealthy days, which is just an average unhealthy days, or I can do arthritis among older adults. I'm just going to stay with physical unhealthy days. And then I'm going to scroll all the way over here. We also have where we can change the age rate because we're dealing mostly with aging. So it's going to be the older years. And then, of course, the next one you can do, maybe you're wanting to compare female versus male, or maybe you want to compare particular demographic. In this case, I'm just going to go with this one. Now I'm able to see it. Has a nice visualization. But the one thing I want to point out is it does tell you the source. So you can go and hunt down where you're getting that information from. Gives you information about the particular data set. And of course, the citation information that comes with it. There's a lot of different information that can easily be found in Sage data. This is provided by the library. It's also a very common database provided by a lot of different universities. So you're able to have that. It's also, the Sage data has an easier interface for help suggestions. But of course, if you're looking for something you're not able to find it, reach out to us. We can help you with it, navigating it better, any of those questions. The next one I wanted to show you was the articles. So when you're looking at articles, where that information is found, I'm going to go ahead and go from the one search page. I'm going to click on advanced search because in this situation, I'm going to use more than one term for searching. I am going to look at not cancer, but childhood cancer. And putting it in quotation marks because I want the system to know that I want these words in this order exactly like this. And then I am going to look at prevalence, if I can spell it correctly. And I want something from the last 5 years. Oftentimes with health data and statistics, unless you're looking at a extended historical perspective, you're going to want something within, I would suggest, the last 3 to 5 years, possibly even going a little bit further to 10. But health is one of those informations that's changing all the time, and it's changing very quickly. So it's similar to technology in the fact that it's progressing rapidly. So you want the latest information that you can find. Again, if you're looking at a historical perspective, or maybe possibly it's a condition that was thought once to be eradicated and now it's appearing again, that may be a time when you start looking at the older information. I'm going to go ahead and hit search. All right, so now I just did childhood cancer prevalence. So this is going to give me a lot of different information, maybe not necessarily the prevalence of just childhood cancer. It may look at different things such as primary hypothyroidism in childhood cancer survivors. So you have all of that information. Now, with this case, you're wanting something a little bit more specific. You would add more terms. You could also even filter down by resource type. In this situation, I'm just going to leave articles. I just want to show you for example, this first one. You also have other studies. So this one's going to have should have particular data in the results that has direct information of what you need. But I'm going to look at this one right here, and I'm going to go ahead and access the actual information. Yay. So I did say that you have the methods, you have the results. You can go down, look at the introduction. It gives a more detailed different methods it used. It used a cohort study, so then you can go and look at the actual cohort study. Um, Looked at different cancer treatment variables, diagnosis. So it has those different methods, information that it found, so you can actually go and look for those. But looking down, where goes the various statistics that they used, results. So now you have the results, they give you a table for it. So this is all health data that you could use in your research if it answers your actual question. In this case, it's been already analyzed once, so it's not the it's not the original research. So you're going to have to take it through the eyes of an analysis that's already been done. Thankfully, they've also provided a table and of course, the method to be able to figure out how that is. But sometimes you'll come around across an article and they're not going to give you a table. They're not going to give you like a wide view of the data. They're just going to give you the overall results and give you their conclusion. So when you're using articles and literature to find health data, you're going to want to look at a lot more than you would just looking at the numbers that are given by a particular agency that gathered that information. But again, like all things, you will have to evaluate whether or not that information is useful for you. And maybe you get into your studying and you start going and then you come up with a question later down the road. Please feel free to reach out, and you can either reach out via my email, again, emily.davis@etamu.edu. If you are affiliated with the university, you can, of course, set up a consultation and we can meet in person or Zoom, and we can go over any more resources that you're interested in. Otherwise, thank y'all for joining.